We welcome one and all from Physio TV family for yet another interesting webinar. So today the talk is based on the female athletes triad, and we'll be having our speakers Dr. Rutuja Kulkarni and Dr. Anisha Nagarkar, and they'll be joined by our expert panelist Dr. Jyoti Purohit. So let me introduce each one of them. So starting with our expert panelist, Dr. Jyoti Purohit has been a friend, an ex-colleague and a partner whom I've worked with in the past, and she has been a sports physiotherapist right from the beginning. She's a director presently at Team Physiotherapy Services in Pune, and she's had more than 16 years of experience in working with musculoskeletal conditions. She's always had her interest and inclination towards sports, and she has accompanied the women's rugby team for Asian Games in Guangzhou, China in 2010. She's also worked with various tennis players, including Ankita Raina, badminton players, cricketers, swimmers, gymnasts, Malcolm players, skaters, boxers, and rugby players, of course. Special interest is in adolescent athletes, holding regular workshops to create awareness of injury prevention in the growth years for parents and players alike. Moving on to Dr. Rutuja Kulkarni, who's one of our speakers today. She is an postgraduate in sports physiotherapy from Lancashire in Preston, UK. She has done it from there. She's presently heading the physiotherapy unit at Abhinav Bindra Targeting Performance Center in Pune. She's a highly motivated and hardworking physiotherapist who's naturally inclined more towards treating sports people over 9 years with experience in sports physiotherapy as well as Pilates. She has been treating ace tennis players who have currently ranked #1 in India. She's a certified Pilates instructor, Australian Physiotherapy and Pilates from Australian Physiotherapy and Pilates Institute. She's also a certified Pilates level 1, 2, 3 instructor and prenatal and postnatal Pilates instructor. Dr. Anisha Nagarkar, who's our next speaker, or one of the other speakers, is also a postgraduate in sports and exercise medicine from the University of Glasgow in UK, and she's had 3 years of professional experience to her credit. She's a certified Mulligan therapist. Her expertise includes sports prevention and management, and she's also a certified dynamic taping expert. Anisha has also a keen interest in racket sports herself and has been a former badminton player and a keen interest in yoga training as well. So I now move over or hand over the mic to Dr. Anisha and Dr. Rutuja. Dr. Jyoti, I think I don't mind you speaking a few words before we start this talk.
Thank you, Sona ma'am, for the lovely introduction, and thank you, Physio TV, for yet again inviting me as a panelist today. And on behalf of Team Physiotherapy, also I would like to extend a thank you. Today's topic is really interesting. It is something that is not very not known so much even amongst the physiotherapists as well. So I'm sure Dr. Anisha and Dr. Rutuja will throw light on it, and we can have a discussion about it, and we'll come to know about the role of physiotherapists in that aspect as well, when we are screening them, when we are treating them. And I'm sure with the growing popularity amongst all sports, amongst all age groups in women, this is definitely an important topic that we are touching upon today. Yes.
So handing over the mic to both Dr. Rutuja as well as Dr. Anisha. Yes, so we'll kind of finish with the talk and then we'll have a small discussion based on the same. So right now we'll mute our mics and take off our videos, but y'all can keep it on, Dr. Anisha.
Okay. I'll just share my screen. So our today's topic is female athlete triad syndrome. So what exactly is a female athlete triad? So female athlete triad is defined as a combination of 3 disorders or 3 components, that is disordered eating, amenorrhea or menstrual disturbances, and osteoporosis. So it was first coined by American College of Sports Medicine in 1992 after noticing a certain pattern among our young female athletes, which were related to these three different disorders. So what does the triad exactly include? So there are certain energy deficiency disorders, which is one important part of this triad: menstrual disturbances and osteoporosis. We'll be looking at all the three components separately into more details. First, let's look at the model. So initially, when this triad was coined, there was a typical pattern that we can see in red, which was known as low energy availability osteoporosis and functional hypothalamic amenorrhea. But over the years, post doing a lot of research in this particular topic, experts have come to this conclusion that there is also another triangle, which is eumenorrhea, optimal bone health, and optimal energy availability. And any disorder lying between these two extremes can also be included in the triad model. So if we consider optimal energy availability as one extreme and low energy availability as a third, whatever eating disorder or maybe low energy, reduced body weight, everything comes under one particular component of this triad. Similarly, it is with the optimum bone health and osteoporosis, where low bone mineral density is one of the component that needs to be tackled. With functional hypothalamic amenorrhea, and which can also be included, triad made up of, and how does an athlete get classified into this triad? Basically, if someone has insufficient dietary intake, you are ultimately going to land up with reduced energy availability, which will classify you into low energy availability syndrome, or you may end up having a eating disorder. Luteal phase defect, which occurs into initial phases of development, may lead you to oligomenorrhea, further leading to amenorrhea. Similarly, incomplete bone formation will cause low bone mineral density, which leads you to osteoporosis and further complications related to the same. So what are the signs of female athlete triad syndrome? So after doing a lot of research, it was found that these are some signs which in any normal person or a female. That is weight loss, which might be excessive weight loss with irregular periods, fatigue, decreased concentration, fractures, overuse injuries, and excessive hair loss. So these are the general signs which you will observe. But female athlete triad syndrome can manifest in different components. Like an athlete may compare herself with her fellow colleague and will come and complain about excessive weight loss, irregular menstrual cycles. She will typically complain of significant trauma, anxiety, episodes of depression, which are quite frequent, nutrition deficiencies. So there are certain warning signs of this triad, which are divided into food related and non-food related. One is food related. So now, what are the warning signs that usually a person should look out to? That is frequent comments coming from your fellow colleague or your players about your excessive weight loss. There might be criticism about others' body weight or shape, and comparing that with yourself or somebody else, a third person. Sudden change in body weight or composition, sudden refusal to eating with others, or not eating at all is another warning sign. Or landing up into chronic dieting without any research behind that or without any appropriate knowledge. But what are the non-food related warning signs that one should look upon? Is suddenly you start wearing multiple layers of clothing to show yourself that you are looking fat, or you are just maintaining your weight and something like that. Then compulsive exercise outside of practice or therapy, obsessive discussion about rehabilitation, stress fractures, frequent episodes of depression, slow healing process once you land up into injury, or longer time in rehabilitating yourself is another warning sign. So what are the risk factors of this triad syndrome? So social isolation, family dysfunction, physical or sexual abuse, then a light or very high level of competition with your fellow colleagues, a traumatic life event. It might be related to any personal issue, family issue, change of coach, your relationship with your fellow athletes or with your coach, any major event that has caused a mental trauma to the athlete, fear, or which might be real or imaginary, of punishment of getting excessive weight gain, over controlling parent or coach, and so on. So now let's look into what exactly the three components are. So the first one is menstrual dysfunction. So what are the different dysfunctions that come under this particular component? That is, first is amenorrhea, that is absence of menses for 3 months or more. Eumenorrhea is menses at interval of 28 days plus or minus 7 days. And ovulation would be complete absence of ovulation. Oligomenorrhea is menses at intervals of more than 35 days. The fifth part, that is functional hypothalamic amenorrhea. It can be primary or secondary amenorrhea, and it is related to three different subcategories. That is, it might be related to weight loss, it might be related to stress and exercise. So what exactly is FHA? FHA affects gonadotropin releasing hormone and luteinizing hormone that leads to estrogen deficiency, further leading to low energy availability. This low energy availability is going to reduce your estrogen hormone and other metabolic disturbances, which would further lead to infertility and ovulation, which is an extreme of this triad of menstrual dysfunction. Now, the second point is energy availability. So low energy availability may be a result of an eating disorder, or lack of nutrition knowledge, or suddenly putting yourself into chronic dieting. Athletes failing to meet their energy requirement as per what sport they are into can be one of the components for lower energy availability syndrome. Imbalance in exercise regime and dietary intake, society pressure, wherein they need to maintain low body weight along with a poor guidance of that nutrition as to they shouldn't look too fat, they need to maintain their body pertaining to what sport they are into, they need to be thin in order to compete at a good level and something like that. So that can lead to eating disorders and lower energy availability syndrome in such athletes. Then bone health or osteoporosis. A lot of bone aggregation, that is gradual accumulation of bone mass, happens during pubertal age. Maximum it occurs between 11 to 14 years in girls. 2 years around beginning of menses is a signal of bone mass growth, which is about 25%. By 18 years of age, all the girls are going to achieve 99% of their total bone mineral content. But certain factors end up contributing to this bone strength. That is, how is the bone mineral content, how is the bone mineral density, how is the microarchitecture, how does the bone remodeling happen. High impact physical activity increases bone density in women. Exercise can cause up to 5% gain in bone mineral density. Hence, awareness of how is your bone strength, frequent check on that is really essential in athletes in order to avoid osteoporosis, frequent fractures, frequent injuries, and so on. So muscle health or strength. Bone strength reduces ranging from low bone mineral density and stress fracture to osteoporosis. Athletes with amenorrhea, in spite of similar weight-bearing exercise, have reduced PMD due to hormonal imbalance. Estrogen is going to inhibit your osteoclastic activity. Lack of estrogen may cause disruption of your bone remodeling and accelerated bone resorption. Hence, everything is related. If you have a low energy availability, you are going to end up having your hormonal imbalances. Because of that, you are going to end up having osteoporosis, which is exactly what the triad is made up of. Now let's go to diagnosis and screening.
Now, understanding, Dr. Anisha has precisely explained what are the symptoms of this triad and how to exactly what symptoms to look for. So, coming to the screening or diagnosis, as a physio, it's quite important to understand if the person has gone through this. If you suspect that your patient is going through this kind of a triad, or if has one or two symptoms, screening is quite important to actually treat it so that it doesn't aggravate in the future. So, what screening tools do we generally use is doing an electrolyte test where we can understand if there is any imbalance anywhere. And then complete blood count again, that gives us an idea of the overall health of an athlete. Erythrocyte sedimentation rate, hormonal test, obviously, that is related to understanding whether the menstruation is frequent or whether it is in the correct line or not. And also urine analysis, which would help us understand the overall health of the body. Now, when it comes to questions, as a physio, taking history is quite important. So, if an athlete comes to you and if you suspect that the person may have this triad, menstrual history would include questions such as when did the menses begin, then the frequency and duration of the cycle is also quite important to understand if the person is suffering from amenorrhea or oligomenorrhea in that case. Longest period without menstruation. So even if the person is not going through menses problem at the moment when the person is coming to you, but it has been in the past. So this question is quite important to understand whether the person has been has suffered because of this. Second question again we can ask was the last menstrual period. These questions we generally may skip if a person is coming to a physiotherapist, mainly it's musculoskeletal or any other injury. So covering this aspect is also quite important to understand if the person has it in the past or may have it in the future. Any hormonal replacement therapy, if the person has taken, even if it is a young athlete, if the menstruation has not been regular or if the person has taken any medications in the past, that history will help us diagnose this condition correctly. So, coming to the next section is the diet history. So, to understand the eating disorders, the patient or the athlete is not going to tell you that he or she has a eating disorder. So to diagnose that, we need to ask what the person has been eating in the past 24 hours. If you still don't get an idea, you can ask them to maintain a diary for 7 days, and then you can observe if there is any eating disorder pattern in that. So highest or lowest weight. So again, people are very conscious about their weight, especially female athletes. So in that case, we should always have a track of the highest and the lowest weight achieved. If the person is happy with the weight or not, this is also an important question to know whether psychologically how the person feels about her body. Ideal weight according to the patient. So for us the ideal weight could be different, but what the athlete is perceiving is could be very different. So that's why asking these two questions will kind of help us understand if she has any eating disorder. Again, some conditions in eating disorders, athletes may take any laxatives if they're not happy with what they have been eating, or just to increase the motion, they might take any diuretics or diet pills. So understanding what kind of medications they have been taking in the past is also very important to diagnose this condition. Now, coming to the exercise history, now exercise is something that is quite important in any athlete. So, what patterns they follow? Are they excessively training themselves? So, understanding how many hours per day they work or how many days per week they are working out. Are they taking enough rest? That point is also quite critical to understand whether the person is directed towards this or not. Additionally, if they are exercising something outside their training perspective. So generally athletes have a training schedule, they have a personal trainer, they have a coach. Apart from that, if the athlete is being too competitive and taking extra training, that could also be one of the reasons to have this kind of a syndrome. Um, History of any previous fracture, this is an extremely important point, because if the person has suffered any stress fractures in the past, that is going to be a point where we will ask them the menstrual history in more detail, because that will give us an idea that they may have any bone related issue as well. So generally bilateral stress fractures or this kind of any frequent fractures in the body is one of the warning signs for female athlete syndrome. Again, history of overuse injuries. If a particular athlete is suffering a lot of injuries, and that could be related to diet as well. So if the person has not been eating well in the past, that could lead to overuse injuries. And generally, they have the tendency of not taking enough rest. So this is something that we can cover. So as a physio, screening is quite important to understand what the athlete may be suffering, or if this syndrome existed in the past or present. It is easily treatable. So that's why understanding whether we know the athlete clearly or not, their history is quite important. Now, coming to which sport does this affect the most? So there is no evidence as such which could tell us that it is common in a particular sport, but it is observed that a lot of female athletes are expected to be fit, lean, and competitive in their sport. And because of the society pressure, which has a lot of emphasis on the body image and how they perceive it, is quite important. So even if we feel the athlete is very fit, but the athlete is not perceiving the same, it could be a warning sign, and that could go into a very severe case of this triad syndrome. So, extreme measures to reshape their body is something that a lot of female athletes have been doing. So, to avoid that, counseling is quite important. So female athlete triad occurs more in girls and women, especially if the athlete is quite competitive. It is also observed in a lot of recreational athletes as well. So categorizing that and understanding the perspective, talking to them is something that a physiotherapist would be able to know if this person is suffering from this, because the treatment completely changes. So not just treating the injury is important, but also understanding if the female athlete is quite competitive or prone to this kind of an injury would help us change the treatment perspective. Now, what there are different or five perspectives through which we should aim our treatment. So, the pharmacological perspective, it's important to take supplements. So, if they are suffering from bone health issues, so taking calcium supplements and vitamin D supplements, or adequate hormonal replacement therapies in case the menses are not regular. So, referring to a gynecologist is also something that is quite important. So, in pharmacology, we try and cover through medicines, but that should be short term. It is not something that can be carried forward for a longer time, as that could impact the performance of a female athlete. Nutritional is the most important aspect, because understanding that intake of carbs, protein, and fat is equally important. Generally, what athletes do is, female athletes who suffer from this syndrome, they take a lot of fiber, and they skip fat. So that counseling is quite important to make them understand that all three components are quite important for good health, and even to get optimal energy from the dietary source that they are using, so that they can perform better. A psychological perspective is something that will help them understand or be more aware that something like that exists, and whatever they are thinking or the perception which they have about themselves, that needs to be changed. So they, it may or may not be true. So whatever is required for that particular sport, that person should be able to achieve, keeping the so help of definitely through life would be, out of this syndrome. As I explained before, gynecological is again a very important aspect to understand whether the menses are being regular or not. So in the past, if the person has this history of irregular menses, so to prevent that in the future, we have to keep frequent checks with a gynecologist, and they can maintain a diary to see whether their menses are regular or not. Also, physiotherapy, now it's the most important aspect. As a physio, I would always say that covering all the other four aspects, or understanding whether the uh, athlete is aware of those factors or not. Because if the person has any injury, any issue, the first person an athlete would go to is a physio. So, as a physio, we have to direct them to all other four aspects as well, so that it is a holistic approach from a physiotherapy perspective. So, coming to the treatment, we'll first rehabilitate them. So if they are coming to us with any kind of fracture, so muscle weakness or any recurrent injury, so we have to identify a pattern, understanding and screening them properly, so that this doesn't happen in the future. coming to the nutrition perspective, so nutrition is something through history we would know whether they are skipping any meals or not, whether they're eliminating one particular group or not. These days, a lot of people are skipping dairy, and they feel that if they avoid dairy, they would, kind of have more lean body. But as it is individual based, but as a physio we would advise them that take a proper nutrition plan from a certified nutritionist to understand, especially if you have a sports nutritionist, that would help them additionally to understand what fuel requirement is needed for that particular sport. If they're training too hard and they're not concentrating on correct nutrition, that would lead to sudden weight loss, and again that can lead to menstrual disturbances. So that's why understanding the nutrition is also very important. So just casually as a physio, you can ask them whether they are consulting any dietitian or not, or if they're not doing that, we can, if it's a professional player, we can definitely refer them to a sports nutritionist. Again, protein intake is something that is, quite important, and it's been the most discussed topic amongst all the athletes and even people who are behind weight loss, and they have this perception that protein is quite important and eating more of protein would help them with weight loss. So that myth is something that we can at least talk to them about, that just not the protein, but eating everything in proportion is something that is going to help them keep optimal energy and keep up with their requirements pertaining to that particular sport. And if they want to increase their performance, eating well is something that is going to help them rather than decreasing intake from their day-to-day activities. Now coming to a particular section of nutrition, that is calcium. Now we all know that calcium is so important to form bones. So right from the beginning, for a child to an elderly person, calcium intake is something that will help them to maintain strong bones. So mostly all the athletes are very much aware of this aspect, but we can make them more aware of what they can eat naturally to increase their calcium intake and not just be dependent on the supplements in the long run. So kale, soya milk, rice milk, orange, broccoli, tofu, chia seeds, sesame seeds. In fact, more than milk, sesame seeds has more number of calcium. Even chia seeds is something that has more calcium. So if someone does not like milk, traditionally, but there has been a lot of research and more
Sorry to
sesame
interrupt
seeds
you, Dr.
have,
Anisha.
you take
Dr.
one
Anisha,
teaspoon of
Dr.
sesame
Anisha,
seeds.
I'm sorry. Is your voice okay? Because the audio is lagging a little bit.
We'll just check.
Yeah, yeah. Okay, thank you.
Are we audible right now?
Yeah, you all are audible right now. But
Can you hear me clearly?
yeah, I can hear you clearly. But at times the voice audio was dragging, So that's why I was wondering whether the Wi-Fi is good. Sorry to interrupt. Yeah,
Okay. No,
thank you.
Now is it okay?
Yeah, it's okay. Thank you.
All right, thank you. So coming back to calcium, there is, if you take one teaspoon of sesame seeds instead of one glass of milk, that has more amount of calcium. So traditionally, whatever the myths were, if you consult a dietitian, which is based on some research, you could be in a better position, and the absorption of calcium will be much more. Second important aspect, the second leg, is mainly vitamin D. So both are equally important, as we all know that vitamin D is available through sunlight. Also, there is very few sources. So cheese, milk, eggs, salmon, or any kind of fish or yogurt, it has vitamin D. But mainly it's through sunlight. But these days, a lot of people, in spite of playing in the sun, they still are facing vitamin D issues. So understanding that perspective, whether in spite of playing, the athlete has vitamin D or not, because this aspect could be neglected. They might perceive this, that they play in the sun throughout the day, so they may not have vitamin D deficiency. So, doing a routine test for vitamin D and calcium will help us to understand whether they have this deficiency or not. So, some athletes may suffer through this triad syndrome, and some athletes may not. So, to kind of distinguish that all the three aspects are important. So not just bone health issues, but it could be because of the menstrual dysfunction or low energy availability. So vitamin D is something that can be screened for all our athletes. Now, understanding the complications of this triad. So if someone is suffering through this triad for a very long time, or especially with menstrual dysfunction that could lead to infertility in the future or any cardiovascular disorders, and that's why they are more prone for any cardiovascular diseases. Also, eventually that could compromise their immune system. A second aspect is the reduced energy availability. So this complication mainly happens because there is imbalance between proteins, fats, and carbohydrate intake. Also, these people, we have observed that they have increased fiber intake because they want to look more lean. And they skip some important aspects such as protein, or they skip fat because they feel that intake of more fiber would make them more lean. So, for example, some athletes would just eat salad in the salad for dinner or salad for lunch, thinking that that will make them lean. But that's really incorrect, and that could lead to deficiency in the macronutrients and essential amino acids and fatty acids, which are responsible for absorption of different nutrients in the body. So having a well balanced meal is something that is very important. Now, combination of menstrual dysfunction and reduced energy availability can lead to stress fractures, or it damages the body's repair process. So even if the athlete is taking rest, they would not get the benefit of the actual physical rest, because the body system and the body's bone health and the hormonal health is not correct. So that's why screening, and then understanding whether they are following whatever suggestions we have given or not. So time to time screening is something that as a physio we all can do. Now, prevention is again something that is better than cure. So having this awareness amongst all the female athletes would just help us prevent any severe conditions. So as a coach, he can remind that eating correctly and keeping a watch on that athlete is quite important. Making sure the resources are available, such as nutritionists, trainers, and counselor, are easily available for that athlete, to make sure that from all perspectives the athlete is in safe hands. Support through training and everyday life. So when, because a coach is someone that who spends the maximum time with an athlete, so from a coach's perspective, every coach can actually screen their athletes and have a one-on-one conversation to understand whether they are following everything or not, and not just training for that particular sport would help. So as an athlete, more people are aware, monitoring their own menstrual cycle using, there are these days there are a lot of apps that actually help you to record everything. So keeping that as a healthy habit, that would help them to understand whether the menstrual cycle is regular or not. Consulting a physician is something that is quite important to have. People who have any irregular menstrual cycle, or they are suffering from recurrent injuries that could be in the form of stress fractures or overuse injuries in the muscles as well. Because for every that is missing in the diet, they may have a lot of injuries, muscular injuries maybe. Talking to a counselor is something that is quite important. Just understand or create that awareness. If an athlete is already aware whether she is suffering through this, meeting a counselor by herself would actually help her to get out of this syndrome as soon as possible. Also, sports nutrition is, as I mentioned before, is something that would help, because the diet changes to a particular sport. So someone who has specialized nutrition would kind of help the person achieve maximum benefit. Emotional support again from not just the counselor, but also from the coaches, the guardians, and teammates. So if required, if it's a very severe case, even a physio or the coach can speak to their parents and provide maximum psychological support. And as a society, if we bring that awareness that having a particular body shape is not bad for any sport, so any anything that is healthy for that particular athlete or that is going to improve their performance, apart from just how the person looks, is something that is going to help them get out of this triad syndrome. Here, I want to just discuss a few case studies we saw at the center. So, one was a 30-year-old female football player. She was a recreational player, and she had come with localized ankle swelling and pain, and unable to bear weight on the foot. So there was sharp shooting, localized pain, lateral aspect of the ankle, along with swelling. It was there since last 1 week. And the pain aggravated in full weight bearing or on extreme plantar flexion and dorsiflexion. There was limited inversion and dorsiflexion as well on examination. She also had a history of menorrhea since last 4 years. So particularly when she had come at that time, that year was good, and that year the menses were regular. However, 4 years before, she suffered from amenorrhea, and she had not taken treatment because she just thought it could be exercise related or stress induced. That's why no medication was taken at that time. However, in the history, we further found out that she had a fracture, radial shaft fracture as well. And once it was on the left, and after 2 years, it was on the right. So that frequency of increased fracture, that we suspected that she could have bone health issues. So we advised for screening, and we also took this questionnaire with her to understand what all she may have positive from taking calcium and vitamin D supplements, but we didn't know whether what exactly was affecting her. So we also advised her to take, which the radiologist found that there was a stress fracture at the distal fibular end. So we diagnosed this condition as female athlete triad at that particular time. Earlier, she had this issue, and with history and meeting the counselor, we found she also had an eating disorder. So these things the athlete may not even tell you, because having ankle sprain or pain, even stress fracture is quite common with many sports. So if the athlete is coming to you, understanding and screening their habits or their routine is also important, along with treating this ankle sprain. There was another case she was a 24-year-old long distance runner, and she was very lean when she came, and she presented with left foot pain, which was localized to first, fourth, and fifth metatarsal head since last 1 month, and it was without swelling. And the pain was only there on the palpation. Otherwise, she was all right. However, the pain aggravated when she was walking, running, and the range of motion was completely full, and there was no pain. But there was pain only when she was walking and running. In the past medical history, we found there was again history of a stress fracture in the proximal tibia 1 year ago, and 3 years ago there was another fracture that was on the metatarsal end. Also, she had rib pain. The history and the reason wasn't quite clear, but she experienced rib pain. When X-ray was taken, we also found that she was tending towards osteopenia, where that could have lead to osteoporosis in the future. So presently, she reported that she used to eat only 2 meals a day, and she used to run for a break or without any rest day. So that was a sign where we thought, this could be female athlete triad syndrome. So there are small things that in the history part, if we look at that correctly, we would know that this person may be suffering from the female athlete triad syndrome. So not just treating the problem which is presented at that point of time, but detailed history and their routine would actually help us understand if the person is suffering from this female athlete triad syndrome. Thank you very much.
So thank you, Dr. Anisha and Dr. Rutuja. So it was really enlightening, and even I didn't know some of the details that was presented in the female athletes trial. And coming to know about it a little more in detail tells us about how a very multimodal treatment module is needed from every angle, which needs to be tackled while dealing with such athletes. So I pass on the session to Jyoti ma'am and y'all to take it a little further. Over to you, Dr. Jyoti.
Yes, thank you, Anisha and Rutuja. Really well presented. And I think you've covered all the aspects of the female athlete triad. And at this stage, it is really important that the physiotherapist community who are dealing with athletes, they are totally, they have this knowledge of screening the female athletes. It is very important that we dig into the menstrual history, like you said. Many a times we do, there is in the questionnaire, we do include whether the menses are regular or, if everything is fine, but it could be sometimes essential to kind of, dig deep into it. And as a role of physiotherapist, like you rightly pointed out, that most of the times, we are the first contact person that the athlete comes to. So maybe not on day one, but as the treatment progresses, if we do catch these early signs, why the athlete is not responding to a regular treatment, if it's just a strain or if we are suspecting a stress fracture, like in distance runners, quite common, then we should definitely dig deep into it and get to the root cause of it. Having said that, I have a few questions. As in, just would be interesting to know whether this kind of a syndrome, is it more particularly seen in individual sports, or are there any incidences of female athletes having this kind of a complication even in team sports? Because just the fact that you covered the psychological aspects of the sport that sometimes cause these eating disorders. So that was just a question that came to my mind, whether, because the individual sport has a different kind of a stress, whereas a team sport is just, I mean, there are pros and cons for that.
Yes.
So if you could just
both the sport has like different psychology, as you said. Team sport is kind of little more competitive as compared to individual sport. However, there's no evidence as such, if it's common in one particular section, but it mainly depends on the person's nature, or how
yes.
what they feel about themselves. So more of it's more individualistic, I would say, rather than it is independent of any kind of a sport, whether it's a team sport or even individual sport, because there is comparison. Even if it's an individual sport, they would compare themselves with someone of a highly higher ranked person, or someone who looks more lean, so they feel that that person is more fit, or that person, if other person is able to do more exercise or more functional activities than that person, however that person
Yes.
could be better. So
Yes. So I guess only thing is I can think of is that in a team sport, usually like at a professional level, at least most team sports do have their own faculty of trainer, a physio, a doctor, a psychologist. So only thing is that it will just get picked up faster
yes,
versus an individual sport, which, it will just get noticed or diagnosed
yes,
much later is
that's
one of the
true.
things that yeah, so that could be one of the things. Also, there are some sports which require like to be in this certain nutrition or a weight category, like some sports like boxing, wrestling, you're supposed to have that particular weight to compete in that category. So I myself have seen some boxers, and there is so much pressure when there is an event coming up, and if they have to shed 1 or 2 kgs, it's really, or they have to gain 1 or 2 kgs. It's
Yeah.
that kind of dieting or that kind of nutritional things that they have to undergo is quite something. So Are there any? Is there any data available? I'm not very sure. There would be, at least in the Indian scenario. I'm not very sure, but maybe it could be a good research topic to see what is. Yes, what could be. So I guess if any of the physios listening to this who are dealing with such such athletes, it's a good point to bear in mind that most of these athletes, they have a very strict nutritional regime every day, before, during, after their practice, their performance. They have to weigh themselves, and every microgram is like monitored. So I'm sure they have this, they should know about this as well.
I think focusing on the sport is more important than focusing only on the weight and function. If they're performing better rather than just how much they weigh. So the focus shouldn't shift that way.
Yes, certainly. That is true for some of the mature athletes who are just trying to, like you mentioned, trying to be in this particular body shape, just so that they would just look fit and leaner, but not keeping in mind that the nutrients are equally important, and they are getting that holistic nutrition to be able to sustain the effects of the sport. So having said that, that's definitely something worthwhile. Also, the other spectrum of say, like post-menopausal, lot of veteran athletes these days are very active into sport. So anything, if you could just enlighten us with anything for them.
So post-menstrual, mainly because there are a lot of hormonal changes in them, and they are anyway more prone to bone health issues. So screening them particularly with more intensity is more important, because they would have to take supplements. They would have to make sure that whether their hormones are correct or not, and that definitely has a psychological impact.
There's a little disturbance. Sorry to interrupt. I think there's a little bit of disturbance from your. I can't even get the video now. Yeah. So I guess there's a little problem with the Wi-Fi at your end. So the voice seems to trail off.
If you could just repeat what you were saying. Yeah.
And there's a lot of disturbance. Can you remove the hands-free and just check whether that's better?
Is this better now?
Yeah, the audio is not as clear as it was before, but yeah, there's a lot of.
Now is it?
Yeah, better.
Yes, better.
Better. Yeah, thank you. Sorry to interrupt you again and again, but there seems to be some little Wi-Fi problem. Yeah.
Yes.
Yeah, continue. Please continue.
Yes. So in postmenopausal women, generally, anyway, they have to be on hormonal replacement pills, and they also have to make sure that the calcium levels are correct or not. So pharmacologically, they have to be dependent on medications. However, psychological screening is something that would help them understand how they feel about themselves, what is their own perception about whether they're able to accept this change or not, because everything is quite changing and still they want to be into that particular sport. So just counseling is something that would help them be more aware, accept where they stand, and then move on and work towards keeping good health, and maybe achieve what they can achieve in that particular age group, and whatever aims or goals they have kept for themselves, that will help postmenopausal women. So mainly a counseling session is something I feel would help them, and physio support, of course. So physiotherapy is something that would help them with frequent screenings, and also help them with the treatment.
Yes. Thank you so much.
We would like to actually thank Physio TV for organizing this and inviting us for this talk. And it was actually interesting for us as well, because this is particularly a newer topic as compared to whatever we have been studying for so long. And because of this, our awareness has also raised. And
Yeah, exactly. So basically, we kind of try to curate the talks such that, the young clinicians as well as even seasoned clinicians who are working out there can have some exchange of ideas, or kind of know new things. Like, I guess as we have our science is continually changing, so whatever was a known fact sometimes is disproved in the recent past, and newer ideologies, newer theories keep coming. So from that point of view, knowing even the recent evidence regarding any old condition also will kind of open maybe some debate, or will open discussion forums, will make you treat the patient differently. So the whole aim of physiotherapy is basically to bring about this sharing of knowledge, this exchange of ideas, which can help therapists across the board. And we kind of try to even get expert panelists, like how Dr. Jyoti is for this talk. In fact, she also had a talk with us in the past, and also has been a part of panel discussions during our Scientifica, which was streamed on Physiotherapy. So from that point of view, I guess, this coming together of all physiotherapists on a platform which can be about sharing knowledges and exchanging notes is a great thing that I guess the Physio TV has allowed us, or rather the Ortho TV, which is our parent kind of platform, has given us this opportunity to kind of have it for physiotherapy profession also. So
No,
yeah,
definitely congratulate all the
we
Physio
kind of
TV.
we thank our chairman also, Dr. Parag
Yes.
Sancheti, and our executive director, Mrs. Manisha Sangvi, as well as Dr. Mr. Rahul Chobe and Dr. Ashok Shah, who are the main creators of the Ortho TV and Physio TV, for helping us stream this, and create this platform. So we look forward to more associations with Abhinav Bindra Targeted Performance Center, as well as Dr. Jyoti in the recent future now. And we look forward to hearing more talks for sports people, not only targeted for sports people, but also targeted towards sports physios, So if there could be some talks on assessments, management, anything that kind of suits us, we'll be getting in touch with you all again soon. So this is signing off from Physiotherapy. A big, big thank you to Dr. Jyoti, Dr. Anisha,
Thank
Dr.
you.
Antuja. So thank you a
Thank
lot
you
for
so
your
much
time
Thank you so
and
much.
for
this
Thank you.
making us
effort.
a part of
Yeah,
this.
thanks a lot. Okay, bye. Signing off.
Thank you.
Bye.
Thank you. Bye.
Bye. Thank
Bye.
you.